Est-ce que vous pouvez me dire si les salles de consommation encouragent la consommation de drogue?
As a part of our scientific evaluation, we were very concerned about the effect of the facility on drug using patterns. However, we were unable to find any evidence that the Insight, North America's first medically supervised injection facility, was in fact encouraging the use of drugs. First, the facility has welcomed over 9,000 people over its first 6 years of operations, and we have not found any reports that any of these individuals were in fact beginning drug use in Insight. They in fact had already been using injection drugs before they had started with Insight. In terms of the use of drugs, we found that individuals were not more likely to use more drugs because of the safety of the facility. In fact, we found that they were using approximately the same amount of drugs because of the number of overdoses were the same before and after the facility opened. Secondly, we found that individuals who were using the facility were more likely than other people to become involved in detoxification and other forms of treatment, including methadone. In fact, in one of our first studies published in the New England Journal of Medicine, a very high-ranking medical journal, we found that individuals, there was a 30% increase in entry into addiction treatment over the first year of the facility's operation. And when we looked at the use of the facility after these people had been detoxified, we found that they were using the facility less. So we feel that there's a positive benefit to the facility on the drug using patterns.
Yes. Et au sujet du coût des salles, est-ce que ça coûte à la communauté? Est-ce que ça fait économiser de l'argent à la communauté?
Yes. We had a team of economists who evaluated the costs and the benefits of the facility, and they estimated that over the first 10 years, the facility would save the Canadian government over $18 million in direct health care costs as a result of averting over 1,000 overdose deaths and over 1,800 infections with HIV. And this, in addition to this, we found that each HIV infection costs the Canadian government approximately $250,000. So this is in addition to that. So the estimate so far that the facility is in fact saving taxpayer funds.
Ok. Et au niveau de l'hépatite C, est-ce que ça que les gens se contaminent moins avec l'hépatite C, avec les salles de consommation ou pas? Est-ce que vous avez fait des études là-dessus?
Unfortunately, in our setting, the level of infection with HCV is very high. We estimate that approximately 90% of the users of the facility, between 80 and 90% of the users, are already infected with HCV because, of course, it is very contagious. So we have not seen an effect on HCV. However, we have seen an effect that the facility is helping these individuals receive treatment for not only HCV, but also the many other infections and health problems that come with drug use.